This is our second year celebrating Juneteenth, and hearing the voices of our very own African American physicians is the perfect way to kick off our celebration. Today with us, we have a special guest, Dr. Christopher Jordan. He is the Director of Sports Medicine Fellowship and also the Director of Sports Medicine Department. Thank you for taking time today to be with us.
Thank you for having me.
So, I'd like to ask you a few questions to help introduce yourself to our fellow colleagues, and that is, what led you to healthcare?
So my journey to healthcare started as a youth. I'd always been passionate about wanting to know how the body worked, and I'd always enjoyed playing sports growing up. And so used to contemplate, hey, how can I make these two be one thing that I can do together? And so playing sports, you get hurt a lot, and myself included, as well as my friends. So I'd watch them get hurt, and we'd go see our athletic trainer, and that led me down a path of, well, hey, this is something I think I could do and be interested in, and combine those two passions. And so, at the time, I was an athlete myself in track, tennis, basketball, cross country, just trying to do as many things as I could. Well, when I attended college, I thought it's probably time to hang up that career. I'm not going to the Olympics. So I chose to go into athletic training at Central Michigan University, and really got a chance to learn firsthand how you can take care of athletes. And so following that time, I took a job, and I was working with high schoolers. And as they get comfortable with you, they start to ask you about things beyond just their injury. And that's what really pushed me to go back to medical school. There were a lot of questions they would ask that I just couldn't answer at the time. And again, being passionate about learning about how that body worked, I ultimately attended Michigan State University, and at the time chose to go into family medicine so that I could just learn about, as much as I could really about the body and how it pertained to people's lives from childhood to geriatrics. But ultimately, that passion for sports kind of came back to the fold, and I pursued a fellowship in sports medicine, and then I was fortunate enough to be employed by St. Joe and continue on now as director.
What a great journey. Can you share with us, why does diversity in medicine matter?
So I think diversity in medicine matters because no matter what your background is, whether that's cultural, whether that's race, whether that's religion, we all are going to require at some point in our lives health care. And when you come into a healthcare facility or see your doctor or your caretaker, it really helps if some member of the team has a connection to you. Whether, like I said, that is something that you find more important religiously, whether that is a connection through culture, it can certainly put your mind at ease that you're in hands with someone who just understands you a little bit better. And so the more we can diversify our workforce, I think the more that'll help everybody.
Thank you. And that's going to tie me into my next question. How could increasing Black clinical representation help address some of the obstacles and disparities patients experience?
I think it's critically important in the Black community that we have more clinicians and providers that look like us or come from similar backgrounds. And the reason being, historically, we have not had a great track record in healthcare in helping Black people feel more comfortable when they come to the physicians. Specifically, the Tuskegee experiment was certainly a travesty, and it's led to a history of members of our community feeling like they can't trust healthcare. I think if we can diversify that and bring more Black clinicians or Black healthcare providers into the fold, it may help ease that anxiety, and then more importantly, hopefully encourage others to follow suit, whether that's seeing a physician or potentially becoming one themselves to help expand that force.
And to wrap this up, Do you have any advice for aspiring Black clinicians?
So the biggest piece of advice I could give is to find a mentor. And by all means, feel free to reach out to me. I'm certainly passionate about being a mentor, but as I went along my own medical journey, I know I could not have gotten to the place where I am without mentors to help guide me, to help show me the ropes. Sometimes there are things that you just may not be aware of where they can tell you, hey, this is the path that you may want to pursue. And certainly along that path, there's going to be ups and downs and various obstacles. And it always helps to have a mentor who's been there before who can help pick you back up and keep you going on and pursuing your goals.